right, good afternoon. Welcome to Bixby Knowles Wellness Center. My name is Dr. Anna Pearl. I'm a chiropractor, and this is my place, so welcome. Sarah and I came up with this idea probably like 7-8 months ago in discussing. I see a lot of prenatal women. She's a perinatal mental health specialist, and she was seeing a lot of women slide right on to from postpartum issues right into perimenopause. And I said, yeah, I'm seeing that a lot in my patients too. So we should definitely do something that serves the perimenopausal, menopausal community. So we are so grateful for you to be here, and we're grateful for all of our panelists to be here. So without further ado, let's turn down the lights. Great. All right. And let's introduce our first panelist, Dr. Lisa Phyllis.
All right. I am Dr. Lisa Phyllis. I am a naturopathic doctor here at Bixby Wellness. I've been in practice for about 20 years. Oh, thank you. I'll start over. No, I'm Dr. Lisa Phyllis. I'm a naturopath here at Bixby Wellness. So we are talking about menopause today. That's me. All right, so this is just kind of defining some of the terms that we use in medicine. Premenopause is basically from the time you start your period to about age 40. Perimenopause is that 5 or so years before you actually stop your period. And menopause, we look backwards and we go, okay, you haven't had a period in 12 months, you're officially in menopause. However, this is all, there's so much overlap that in real life, nobody cares about these terms. This is just, okay, where you are in your life. So when we're talking about our normal, quote unquote, normal cycle, our 20s and 30s, when we start our period, on the first day, we have no hormone. Then as we go through our weeks, estrogen climbs, and then we ovulate, and it kind of drops a little bit, and then it gives a little spike, and then comes down again. Progesterone, the green line, we don't have any progesterone at the first couple weeks of our cycle. Then we ovulate, it comes up, and we have a huge spike second half of our cycle, and then it comes down again. If we are not pregnant, this drop in hormones still signals for us to have our period. So this is a normal, quote unquote, normal cycle. Testosterone pretty much stays the same through this time. And it's very common for our numbers to get up, 200 or 300 with our estrogen. I bring that up because when we're testing hormones in the future, we kind of want to know where we are. This is when we are having our cycles, 20s, 30s, it's pretty rhythmic. It's consistent. Even if you're not perfect, it's consistent. Then we hit perimenopause, and it is, excuse my language, a shit show. It's all over the place. Here, there, sideways, backwards, it is all over the place. And then we go through menopause, we have no hormones, and it's literally a flat line. So I look at this as a visual representation of my patients going, I feel like crap. And I'm like, well, of course you do. It's all over the place, and then you have nothing. So you're not crazy. Oh, let me come back to this. Okay, so 3 things I want you guys to know. You are not alone. You look around this room, there's 25 women in here. We had a panel earlier, there is 12 women in here. So you are not alone going through this process. And you don't have to suffer. There are 6 of us up here. You've got your doctor, you've got your therapist, you've got your priest. You're not alone. You don't have to suffer through this. And hot flashes are not the only symptom. You go to your doctor and you say, I have hot flashes. Okay, but what if you don't have hot flashes? What if you have brain fog? What if you can't sleep? What if you've got aches and pains, right? So there's a lot of things going on. I found this earlier this week. I thought it was very funny. Remember that time I thought I had diabetes, a brain tumor, Lyme disease, or a blood clot, but I was really just going through perimenopause. All right, so menopause is not a disease. It just feels like one. We're all going through menopause. Every woman in here is going to stop having a period. This is a normal process. However, it can be really, really difficult. As you can see from those slides, your hormones are all over the place. So what we're trying to do is make this transition as easy as possible. So we can do hormones. There's a lot of herbs that can be helpful to this process. We certainly want to look at stress. So stress is another player in this. Even though we're talking about hormones, stress is another major hormone that we use, or that we look at, because it plays a big role here. This is kind of hard to see, but everything comes from cholesterol. Cholesterol makes our hormones: progesterone, cortisol, DHEA, testosterone, estrogen. The reason I bring that up is when we're going through our cycle, if we have a lot of stress and we're producing a lot of cortisol, it is going to steal from progesterone. It's fine. You got a week of a stress, right? You're going, you're going on a trip, whatever. Okay, you lose a little bit of progesterone, no big deal. But if you've got months and months, years of stress, all that extra cortisol pulls from the progesterone. And we go back here a little bit, we can see this, you're supposed to have a lot of progesterone here. If it's slowly decreasing, this is even in your 40s, it's decreasing, then when you start to have your cycles, you're having more and more and more symptoms. And when you go through menopause, your ovaries stop producing your hormones and your adrenals take over. Adrenals is the hormone, the gland that produces cortisol. So if you are going through menopause, your ovaries are stopping, and now your adrenals are trying to take over, but you've had years of stress, your adrenals are just tired, and then we have a lot of symptoms from not having enough hormone. So we definitely want to look at stress. Okay, let's talk about the elephant in the room about cancer. Bioidentical hormone replacement does not create cancer. There's a study 20 years ago that was looking at women's hormones, women's health, and they stopped it prematurely in 2002 because they were seeing, oh, hormone replacement gives you cancer. So for 20 years, the collective mindset was, oh, don't take hormones, you're going to get cancer. Well, now they've gone back, thank God, and realized that the problem was the synthetic progestogen. It wasn't even the synthetic estrogen, it was the synthetic progestogen that was causing the problems. And now we realize estrogen is actually protective. So now, finally, the medical world is going, okay, we need to actually have some hormone. So there are certain cases, of course, that we're not going to do hormones if you already have had a history maybe of breast cancer, but for the most part, this is not a problem. To me, the bigger problem is we've got collective thinking that, oh my gosh, we're going to have cancer. Invariably, a woman will come in, I've got issues, I don't want to get cancer, I don't want to get cancer. You're not going to get cancer. And now we have this huge gap of a generation who didn't get help because they suffered needlessly, and they didn't get help because, oh my gosh, you're going to get cancer. So I just like to, talk through that. Okay, so what can we do? Obviously, I'm a naturopathic doctor. I'm my daughter too, but so I do hormones, but it's also about stress and sleep and nutrition. So we're looking at everything, right? Yeah, we might do hormones, but we'll probably be able to talk about maybe some herbs to help you sleep, or maybe we'll do. You need to get some exercise. Maybe we'll start looking at your stress hormones. Estrogen. Every cell in the body loves estrogen, so we need estrogen for our brain, for our heart, for our bones. So I'm not always going to push hormones on you, but that is certainly something we will talk about. You may come in, if you come to see me, and decide, I don't want to do hormones, but I'm definitely suffering. So we maybe talk about herbs, maca, St. John's wort, black cohosh, all very helpful. So big picture, we're trying to have healthy aging. Okay, I went through that a lot faster than this time. The point is, there's help. Does anybody have any questions? Did I miss anything on my list? Thank you. Put my glasses on. Oops. No, I got it. Thanks. Oh, I did. Thank you. I wanted to show a case where this is a current patient. She's 47. She's still having her period. Her estrogen is 38. Now, it's maybe hard to see, but she should be 100, 150. There's a little bit. If you look here at postmenopausal is 54. So she has even fallen down lower than the postmenopausal range. But she's still having her period, so her doctor's like, well, we're not going to do anything. We have to wait, right? She's suffering for no reason. So I just bring that up because it's really important to find somebody who is willing to look at the big picture of what's going on for you. So, okay, I think I said everything. Yes?
I'm just curious, how do you do this type of testing?
So I will use blood tests. This is a blood test. I'll use saliva testing. I'll use urine testing. It kind of depends on the individual person. Typically, blood work is covered by your insurance. We like that. Saliva test and urine is a little bit more thorough. So if there's other issues, let's say you're having trouble clearing your estrogens, I might run a saliva test or a urine test because it gives you a better idea of how your body's metabolizing it. For the bare bones of what's going on in your body, this is a really good tool with blood. And it's easy, right? A poke and you're done. Yeah. Yes?
Going back to that, I've heard that test you have to be on your period.
There's a certain time of the month. So if we go back to where we here, if we test your hormones the first week or so of your cycle, it's not going to be helpful because progesterone is naturally low. So if we test it then, it's not going to be that helpful. So we like to test it between day 18 and 21. We know progesterone is supposed to be really high, and we know estrogen is a decent height. So we typically test at that point.
But if you don't, what if you
Oh,
don't really
if you don't have a period.
Yeah,
Right.
or you
So now you've already
don't
passed
just
over.
get a regular
Right. So if you are already postmenopausal, you got nothing.
What if
Okay.
it's like every other month?
Oh, okay.
Exactly.
Right. So if it's all over the place,
Pretty regular.
we kind of guess. I don't mean to guess like, oh, we're just guessing, but we go, okay, where do we think we are in your cycle? So let's say you haven't had a period in 2 months. Sometimes you feel like, oh, it's coming. If you don't, we just go, okay, let's test it today. What's going on? And with the idea that it's all over the place, right? It is literally today is this way, next month it may be completely different. So this is a hard time to test, but it gives us some good information. If you test really high, okay, we probably wouldn't put you on estrogen that day, but we might give you some progesterone to help to balance that out. So does that make sense? Did I answer your question? Okay.
What role do symptoms play?
Symptoms are everything. Well, symptoms are everything,
Right.
but the blood work can be helpful to define where we go with that. Yes.
Does birth control have to test for birth?
It does. So if you are, and it depends on which, if you're on an estrogen or a progesterone-based hormone, that might affect what we do. So sometimes we will have you go off the birth control if it's tolerable, if we really think we need to get an accurate reading. If you are on birth control and you're starting to have symptoms, then we might just base it on your symptoms and not do any blood work because that won't be as helpful. We've been doing hormone work for years without always doing blood work, right? This is a great tool, but it doesn't have to define everything. Yeah. Yes.
I have read that you should take progesterone if you're taking estrogen.
Correct.
But if you don't have uterus anymore, taking this.
Correct. When they do research, you don't need progesterone if you don't have a uterus. However, progesterone can be very helpful if you're having sleep issues. So even if you don't have a uterus, we still might do some progesterone just because it helps with sleep. Yeah. Yes.
So what if you don't have your period anymore?
So you've already gone through menopause. If you haven't had a period in a while, I probably wouldn't do blood work. I'd probably just say, let's get you on some hormones or let's get you on some support and start to treat your symptoms. Yeah. Yes.
Do you recommend us keeping a journal of where we are and symptoms along the way?
It is very helpful, especially if you're in this transitional period of it is all over the place, because each month can be different. It's crazy making, as we're all here realizing. It's crazy making. 1 month you feel great, the next month you want to kill somebody, the next month you're crying, the next month you're running a marathon. It is literally all over the place. So if we're trying to figure out, are your symptoms related to hormones, having that diary of some sort is very helpful. Yeah. Yes.
What if you've had a hysterectomy like a long time
Mhm.
ago, or a partial hysterectomy?
Yep.
You don't have your period. I haven't had it for a while.
Right.
So how would you know where you're at?
All right. Well, you still have your ovaries because you only had a partial, so your body is still cycling. There's nothing to bleed out, right? So a lot of times when you still have your ovaries, because you know your body better than anybody. Oh, I should be getting my period. You start to have breast tenderness or irritability, and then a couple of days later it passes. Oh, okay, I had my period. So that's one way of saying, okay, you're still having it, or I haven't had any symptoms for years, and now I'm dry, I'm moody, I can't think. Then we would really want to look at putting you on some hormones. Yeah. Yes.
So thinking of someone who has their period, they can essentially take their temperature to identify when ovulation is.
Mhm.
Would that give you any insight during perimenopause and kind of like?
Not necessarily, because sometimes you're not even ovulating. In this time, it is such a crapshoot. You're not even ovulating. So if you feel like, oh yeah, I think I'm ovulating, that would only be helpful to know maybe when we start the progesterone, because typically we're only doing progesterone dosing the second half of your cycle. So that might be helpful there. But if you're a couple years away from menopause, you may not even be ovulating anymore, or you may only ovulate 3 times a year. Yeah. Any other questions? Yes. Oh, sorry.
How do you know which hormone would be best for you? If it's more progesterone, estrogen, or is there like a mix? Or how do you know what's best for your body?
Right. So we as women, we're mostly estrogen, progesterone. We have a little testosterone, and we can maybe talk about testosterone in a minute, but most of our symptoms come from that decrease in estrogen. Estrogen is anti-aging. Our bodies love estrogen. Every cell responds to estrogen. So most of the symptoms that we're having, hot flashes, mood swings, dry everything hurts, is because your estrogen is just dropping so much. So that's typically where you're going to feel better, is we replace the estrogen. Unless you don't have a uterus, we're also going to give you progesterone too, so it's helping to protect. But if we're thinking that stress is a major player here, then we may focus a little bit more for someone like that on more progesterone. Or if you're having terrible sleep issues, progesterone can be really helpful for sleep. So we might focus a little bit more on that. But typically we give both. And I didn't talk about, you're right, I didn't talk about something. Bioidentical. So I talk about bioidentical hormones. That means the estrogen we give you looks exactly like what our body produces. You can get Premarin, which maybe some of you may know, it's horse urine. That's what they've been giving women for years, is what that women's health study was on. That's not bioidentical. It comes from a horse. There's birth control. It's still an estrogen, but it is not bioidentical. It doesn't look exactly like what we produce, so there's a little bit more symptoms. So we use what we consider bioidentical. It looks exactly like what our body produces because we know it's healthy. Yes?
When it comes to mood swings,
Mhm.
I recently had an episode of being so hormonal, like it reminded me of when I was pregnant with
Mhm.
my kids.
Yeah.
Getting so, maybe I was very angry and could have lashed out, and a bomb could have went
Yes.
off.
Yes.
I'll put it. But I vented and I diffused the bomb.
Okay,
it took
good.
3 days.
Right. Right.
But I said, oh my gosh, why was I so wound up? And then my period started like
Right.
a second later.
Right.
So I knew it was hormones raging.
Yes. Yes.
How do I control that, or what can I do in the meantime so I don't hurt anyone?
Right. We'll get you a bubble around you. Yes. So are you still having cycles?
Yes.
Okay.
But I just had my first like weirdness. Like I
Mhm.
think I missed one,
Right.
and then it was there and gone and came back, and
Right.
I'm in the middle zone.
Okay, great. So there's an herb called maca, specifically a company called Feminescence. And the reason I bring that up is they've done numerous studies on the different strains of maca, and they can give you, their website has all these studies. So I like that. Maca is really good at helping to balance this. For you, because you just started the weirdness, you may not be something we want to throw hormones at, right? Maybe we just want to use lifestyle, nutrition to kind of balance that. So we might do something like maca. There's a number of herbs. Dr. Long is going to talk about some Chinese herbs. Dr. Sarah is going to talk about some mental health stuff. But there's answers. So probably the best bet was to get one of us or talk to your doctor and go, here's where I'm at. What can I do? Because there's an answer for you. There's an answer for everybody in here. Yeah, but I like maca for that. All right, all good? All right, Dylan.
Okay, hi everybody. My name is Dylan and I'm an esthetician here at the Bixby Knolls Wellness Center. And I'm going to talk to you a little bit today about changes in the skin during both perimenopause and menopause, and then also some ingredients that you can incorporate into your regimen that will kind of help to balance your skin and get you through this time. So, as Dr. Phyllis said, this is a transitional period. Perimenopause is a transitional period leading up to menopause, and our estrogen is spiking and crashing. It's unpredictable, it's chaotic. Our hormones are in flux, and our skin also is in flux. Some of the things that we will see is collagen levels start to decrease. So collagen is a protein that gives our skin structure and elasticity. And as our estrogen dips, so does our collagen production. Cellular turnover slows. So when we're younger, our dead skin cells that are on the surface layer slough off, and that sends the signal down to the new skin cells to migrate up, and everything is working perfectly. As we're aging, those dead skin cells hang around a lot longer and the new cells don't make their way up. And what that means to your skin is you can have a dull look to your skin, hydration, all the other products that you're using are not able to penetrate past those dead skin cells. And we're seeing more wrinkles, deeper wrinkles. This process is vital for healthy, hydrated, glowing skin, and it's super easy to achieve. Loss of elasticity. Elastin is also a protein that's in our skin, and it allows our skin to stretch and then return back to its original shape. And then as we're aging, the things are stretching, but they're not really going back to their original shape. And it helps to maintain skin firmness, flexibility, and it helps to reduce visible wrinkles. We also see hydration and oil levels out of balance. So you can be like super oily, maybe 1 month, and then the next month, super dry. This can also fluctuate weekly, so it's a lot of fun. And you really need to kind of reassess your products throughout this perimenopause time, because something's not going to work for you all the time. So you might tuck something away, and then when you're dry, you can pull something out. So you're always going to want to kind of be assessing how your skin is feeling as well as how it looks. Estrogen plays a huge role in keeping our skin hydrated and plump. And it's really, really important to use moisturizer, even if you're oily. We lose a lot of moisture to evaporation. And then also if you're sleeping with a cotton pillowcase, that also steals moisture from your skin. And a moisturizer is going to work like a second skin. So it's going to keep the good stuff in, the bad stuff out. And it's just super important to be using a moisturizer. Then we're going to see increased skin reaction and sensitivity. So maybe you've been using a product for many, many years and it's been working great. And then all of a sudden you're getting irritated or your skin is red or it feels painful. This is totally normal during this time. So that's also why it's important to kind of reassess your skincare regimen. Environmental stressors such as UV damage, dry weather. We had low humidity here back in the beginning of the year when we had all the wildfires, and like my skin and so many of my clients' skin was just so dry, couldn't get enough moisture. So you want to keep an eye on, drastic weather changes. And air pollution. We live in an urban area, so we definitely have a lot of environmental stressors. You might experience slower healing time when you have like peels or laser done, microdermabrasion, any of those kind of resurfacing treatments. Just might take your skin longer to heal, and you might need to use more products that will kind of speed that healing along. Let's see, redness. Redness can be caused by irritation from a number of things. It can also be a lack of oil or moisture in your skin, so that all goes back to balancing out the skin. And then hyperpigmentation, age spots, sunspots. Changes in estrogen levels can fast track the visible pigmentation. So maybe you didn't have any pigmentation, then all of a sudden you look in the mirror and you're like, oh my gosh, where did that sunspot come from? Most of that damage has already been done and it's chilling beneath the skin, and different things will bring it up, and one of them is drastic changes in estrogen. You may have seen or experienced when you're pregnant, there's something called the pregnancy mask or melasma, and that definitely is because of hormones. 99% of the sun damage that we do is before the age of 18, when we're super smart and we're wearing lots of sunscreen. So I don't want to bum you guys out. It's treatable, but just to kind of know that now you definitely want to be protecting yourself with sunscreen, reapplying hats, just being more mindful. Breakouts, definitely get breakouts. A lot of women will get it around their chin area. That's a classic hormonal area. It can range from little papules and pustules that come to a head. You pop them, get on with your life. Or it can become, cystic acne, where it's hard red bumps. Nothing seems to want to come out, and they stay for a long time. And then sun sensitivity. I know for me, as I got older, and now that I'm in perimenopause, super sensitive to the sun. Like it makes me itchy. So that's definitely something to be aware of. And then on to menopause. During menopause, once we've reached the stage of menopause, estrogen is consistently low and everything slows down. So you're going to see dramatic changes in hydration levels, in the elasticity of your skin, in the skin density, the thickness of your skin. Our collagen production drops drastically in menopause, 30% in the first 5 years of menopause, and that's a big jump. Oil production dramatically slows down or stops. So for those of you who are oily, hang in there. Skin becomes more sensitive, thinning of the skin, rougher texture to the skin due to the lack of oil, and maybe if you're not exfoliating enough, those dead skin cells hanging around. Pigmentation becomes more stubborn and sometimes permanent. So that's why when you first start to see pigmentation, it's really smart to kind of start treating it. You're going to have much better results with that. And then often we see dryness. You can skip the next one. Okay, now we're going to talk a little bit about some ingredients that'll help you guys out. So starting with perimenopause, kind of what we want to focus on is lightweight hydration, balancing products, gentle exfoliation, and then if you do have a breakout, you really want to treat it gently and carefully. Do not over dry the skin. The skin is very temperamental, and if you push it too far, it's going to rebel and just give you more of what you're trying to get rid of. So first ingredient would be peptides. Love peptides. Peptides are the building blocks of collagen, and they are the fuel or the food for fibroblasts. And what fibroblasts are the chemical reaction that is in our body, and when the explosion happens, it creates collagen. And when we're younger, these fibroblasts are popping off all the time, and then as we're aging, it's kind of slowing down. So what peptides do will kind of get those fibroblasts going again and get your body to produce its own collagen, which is the ideal way to get your collagen. Hyaluronic acid, we have hyaluronic acid in our body, but as we age, it starts to slow down. So what we want to do is we want to supplement hyaluronic acid. There's a ton of hyaluronic acid out there, but they're not all created equally. And what you really want to look for is a multi-weight hyaluronic acid. And what that means is there are different size molecules of hyaluronic acid in the formula, and they're able to penetrate down to different layers of the skin. And kind of what you want to think about doing is hydrating from the bottom up as opposed from the top down. And multi-weight hyaluronic will get you there. When we're younger, our skin cells are plump. I think of grapes. They're robust, they're plump, they're juicy. And then as we're aging, they're kind of turning more into raisins and they're getting a little more shriveled. And hyaluronic is going to help rehydrate those raisins and plump them back up. And it really makes a big difference really quickly. Niacinamide, which is B3, that is one of those ingredients that's going to touch on many, many different skin issues. And it's a wonderful thing at any age to incorporate into your skincare routine. It will strengthen your skin's barrier. It will help to regulate oil production. It reduces redness, hyperpigmentation. You can find it a lot of times paired with, I've been seeing it with an ingredient called bakuchiol, which is a retinol alternative. So if you are experiencing sensitivity, but you still want to use something that's going to give you the results of a retinol, bakuchiol is great. And the company that I work with, Eminence, they have a wonderful moisturizer that's bakuchiol and niacinamide. Then we move on to phytoestrogens, and phytoestrogens are plants that mimic and supplement your body's own estrogen, and they're really helpful for your skin. So some of the things you can look for are yucca extract, red clover, soy, and hops. I've seen those in lots of different products, and those are really going to help with hormonal skin. You really want to be avoiding hormone disruptors all the time, but it really messes with your skin when you're going through hormonal changes. So you want to be on the lookout for BPA, phthalates, parabens, sulfates. Those are used a lot in beauty products, and they're just no-nos. And you'll always see if a company does not have these ingredients, they will put it on the bottle. Same with a multi-weight hyaluronic acid. If they have it, they're going to scream it from the rooftops that it's in their products. So look out for that. Then we get on to vitamin C. So important. It's one of the 2 most important ingredients for your skin for your whole life, but specifically when you're going through hormonal changes. Vitamin C is an antioxidant. It helps to brighten and even out your skin tone. It helps to boost your SPF's efficacy. So if you're wearing a 30, it's going to kind of make it even more protecting. And antioxidants protect against free radical damage. And free radicals are unstable molecules that are missing an electron. And their sole purpose at that point is to grab an electron. And what they're going to do is they're going to steal it from one of your healthy cells. And so you're going to get cellular damage. And if there's a lot of free radicals, which are from the sun, from pollution, from smoking, then they're going to just attack your cells. And you want to stop that. So vitamin C is definitely the way to do it. Vitamin C, not all is created equal. There is one form of vitamin C that is the gold standard for vitamin C and really what you want to look for. It is called L-ascorbic acid, and it is the most potent and the most kind of reactive one that you can find. Vitamin C is not the most stable ingredient. It oxidizes easy, so you really want to try to find something that's in a dark bottle. Glass, preferably. You want to keep it out of the sun. And yeah, vitamin C. Can't say enough about it. Lactic acid, great way to exfoliate, super gentle. It has a really slow rate of absorption, so it stays kind of on the surface level, and it's just removing dead skin cells, and most people tolerate it really, really well. Enzymes are the gentlest form of exfoliation. They are able to dissolve the bonds that hold dead skin cells to your face, and then they stop. So they're not affecting living tissue at all. They are great for the most sensitive people. Everyone can use enzymes. So definitely look for enzymes. And then SPF. I'm going to give you guys a hard time about SPF. SPF is so, so important. And I think where most of us, including myself, falter is the reapplying of sunscreen. So your sunscreen's good for a maximum of 2 hours once you apply it. If you're swimming or running, 40 minutes. So I know, I'm sorry, I hate to be the one to bring this to you. But there are things like powdered sunscreens, which are game changers because you can put that on multiple times right over your makeup, or if you're not wearing makeup, it doesn't look powdery. You can throw it on in your car. The company I use, Eminence, they have a powdered sunscreen. That's a really great way to kind of get your reapplication going. The sun is the #1 ager. And there are different types of UV rays, and the ones that are going to age you are going to be the UVA. UVA stands for aging. And those penetrate the deepest down into the dermis, and they are able to kind of destroy collagen. They mess with your elastin. So UVA, and then there is a new UV ray that is causing a lot of damage, and they're calling it blue light. The sun gives it off, but not like our screens. So our computers, our tablets, our phones, and those rays actually are penetrating further than the UVA. So they are causing the same kind of damage, pigmentation, wrinkles. So even if you sit in front of a computer all day and you feel like, I don't go out in the sun, you have to wear SPF and look for something that protects against blue light. It's kind of new, so not a lot of companies carry it. Eminence, all of their SPFs protect against blue light, but that's something you definitely want to think about when you're purchasing an SPF. Okay, moving on to ingredients for menopause. So once we're in menopause, what we want to focus on is deep hydration, barrier repair, gentle exfoliation. A lot of the ingredients from perimenopause we're also still going to use in menopause, but we're going to add a couple more. So you're going to have your peptides, which we talked about, ceramides, super helpful. A lot of times you'll see peptides and ceramides together. Ceramides are a waxy lipid molecule, and they help to prevent water loss. They reinforce your skin's protective barrier, and they also protect against irritation. Hyaluronic acid, vitamin C again. And then here is where we really want to visit vitamin A products. So retinols and retinoids. Retinols are usually going to be your over-the-counter, and they're going to come in about 0.5%. And then once you get into the prescription strength, those are known as retinoids. And those are going to be like your tretinoin, your vitamin A. I always recommend that you start with an over-the-counter one. They can be kind of irritating, and sometimes your skin needs time to acclimate to it. But vitamin A is, I've talked to many dermatologists, the number one anti-aging ingredient that you can use in your skin. It speeds cellular turnover, it stimulates collagen production, it slows melanin production, it lightens pigmentation that you already have that's showing, and it reduces inflammation. Then we have probiotics, probiotics for the skin. And those are going to help to balance your skin's microbiome. So they're going to help keep the good and bad bacteria in check. And that's really going to help with like inflammation, and it's going to help strengthen your skin's barrier. And you can kind of see there's a trend with barrier, and that's really what it's all about once we're in menopause. And then we have omega and essential fatty acids topically, and those also help to maintain the skin's lipid barrier. They help to prevent water loss, and they reduce inflammation. And then finally, SPF again. And same thing as I said before, super important. But I think with these ingredients and just kind of knowing, it's really easy to kind of get your skin in check and have your skin be glowy and happy through all of this. So I would love to see you guys. We can talk more about skin, and we can get your skin in check. Thank you guys. Oh, does anyone have any questions? I always forget the question. Yeah. Oh, thank you so much. Thank you so much. So I feel like I've been working on my skin for a long time, and now what my issues are the fat beneath. So as we're aging, we're kind of also, our fat layer is kind of starting to compress. So that is kind of going to be my next focus. But thank you, I appreciate it.
Let us know how to handle that.
I will. Anybody else? Yeah, vitamin C. So vitamin C, I think, is good day or night. Like a lot of my clients ask me, when should I be using vitamin C? It's great for both, but I especially think in the daytime because yeah, it like supercharges your SPF and it helps to protect you even more. Plus it's neutralizing those free radicals from pollution in the sun. And that's when we're dealing with most of that. So definitely vitamin C in the day for sure. Yeah. Hi.
There's a couple products like collagen peptides and things that have like hyaluronic acid.
Mm-hmm. Uh-huh. Yeah, totally. Yeah, I think that it's many sources that you can get it from. Like I know a lot of people will drink like a collagen. I drink collagen supplements. And when you're working kind of internally and externally, and there are a lot of products out there, especially serums, that are going to kind of have a lot of these ingredients in one. It's just you want to make sure you're looking for in the hyaluronic, the multi-weight hyaluronic, and then in the vitamin C, you want something that's stable. So that's where the dark bottle comes in. And then also that L-ascorbic acid is going to be like, it's really the only way to go. It's probably going to be the more expensive vitamin C, but there's just so many results on how much like more it does for your skin than just like your regular other versions of vitamin C. Yeah.
So how much vitamin C, like is there a number?
No, there's not really a number on the skin. It's more about consistency. So as long as you have like the really potent vitamin C, then you just kind of follow the directions. Like I know the brand that I carry, it's like 5 drops in an application and it's very liquidy. So it's able to really kind of penetrate down. But yeah, I think it's just more about consistency every morning, like vitamin C for sure. And then as you know, as you're aging, you might want to incorporate some other things in there. I throw everything at it. I'm like, everything on this list, please. Anybody else? Okay, awesome. Thanks, guys. Next, we have Dr. Long.
All right. So I'm Dr. Long, and I'm going to talk to you about the Chinese medicine perspective on menopause. So Chinese medicine has been around for thousands of years. It's a very ancient practice, and it focuses on different cycles in nature. So we're all a part of nature, and so we follow these cycles too. So the first is to look at the 7 cycles of our lives, and they are divided up into 7 years each. So the first phase is when you're between 0 and 7 years, and you're growing, and you have your teeth growing in, and thickening of the hair. Phase 2 is 7 to 14 years when menstruation begins. Then phase 3, 14 to 21, you have your wisdom teeth start to come in. And then phase 4, 21 to 28 years, there's your prime reproductive years. 28 to 35, the muscles begin to slacken, hair is starting to thin. We're starting to have these different changes that come along with the hormones changing. 35 to 42 years, more signs of aging and the graying of hair. And then 42 and beyond, you have the onset of menopause. But in Chinese medicine, we call it the second spring. So it's not seen as like an end to all of this. It's a new beginning. It's a time for regeneration, rejuvenation, and taking care of ourselves for our next phase. And so there's a few terms that you'll hear us talk about. One is called kidney essence. It's also known as Jing. And kidney essence is the foundation of growth and reproduction, and it's inherited from your parents, and it makes up our basic constitution. Now, it's stored in the kidneys. That's why it's called kidney essence. And it's nourished by the things that we take in. So our food, water, air, all of those things. And there's this balance between yin and yang in this situation. So the yin is the cooling aspect, it's moistening, and the yang is more moving, activity, growth, that kind of thing. And aging is just the physiological changes that occur with the decline in Jing. And this is just to kind of get more familiar with these terms. So we talk about Jing, Qi, and blood a lot of times in Chinese medicine. So Qi is the energy in our body, the energy it takes to do different activities, anything active. Blood is what nourishes our body, and the fluids also help to moisturize and nourish our bodies too. So as you can see there's Qi, and over here is blood. The Qi helps to generate blood, it helps to move the blood, and it also holds the blood in the vessels. And in turn, the blood helps to nourish the rest of the body and nourish the Qi. And then let's look at essence up here, Jing. It's, as I said already, it's stored in the kidneys, it's inherited from our parents, and that's what we call primordial Qi. Then the air and the food and water we take in, that is also contributed to what is combined with our primordial Qi as our normal Qi. And that is what nourishes our body, and it serves as a protective barrier for outside influences. And as we are having this change in the levels of Jing, we have the symptoms of menopause. So night sweats, hot flashes, fatigue, sleep issues, body aches, things like that. And so good news is acupuncture and Chinese medicine can help with this. So first, we'll look at acupuncture. How is it helpful? So acupuncture affects the hypothalamus, which is our temperature regulator. And so it helps to balance things out so that you have reduced hot flashes. It also stimulates the release of endorphins, which are known as the feel-good chemicals in our body. Helps to reduce anxiety and promote relaxation. And sometimes during menopause, we have body aches, and so acupuncture is really helpful with that. It decreases inflammation and reduces those pains. And it also can help with your sleep cycle and reduce fatigue. And there's lots of research that's been done. I just chose this one to highlight some of the effects. So menopause, we talk about the vasomotor symptoms, VMS, which are hot flashes, night sweats, flushing, and usually they occur like a chest, back, neck. And so they took several women, and they were aged between 45 to 60, and they were having these symptoms 4 or more times a day. And the acupuncture group received 20 treatments over a period of 6 months. And they noticed a decline of these symptoms by 36.7% in the acupuncture group. And in the control group, actually, they had an increase in those symptoms. So Chinese medicine isn't just about acupuncture, it also includes Chinese herbs. And usually herbal formulas have a combination of herbs, and a lot of times they include this for these symptoms. This is called danquai, and it helps to reduce night sweats and hot flashes. And so a lot of times it'll come in a pill form, or you can make a tea out of it. There's lots of different ways to take it. And then another herb that's commonly used is called di huang. And this nourishes the yin, and it also nourishes the essence or jing. It can help improve bone health and cognitive function. Now, the next two slides, I have some herbs that we're going to try. These you can use as a snack. They're not always in a formula that you can have them by yourself. So the first one is called longan fruit. And with this one, it's very helpful with promoting more rest and have a refreshing sleep. It helps to nourish the qi in blood. And so it's blood building, and it's a heart tonic. And it's also high in iron. And then the other one is goji berries. And there's different quality of goji berries. Some are really dried out, and these ones are a little bit stickier. They clump together, and they're used different ways. So the goji berries, they tonify the jing, or the kidney essence, and the qi. It helps with your mood, and it's blood building, and it's also anti-inflammatory. It has lots of antioxidants. It's rich in vitamins and minerals. And then I have a few recommendations of Chinese medicine for lifestyle and diet. So if we're having a lot of these heat symptoms, we don't want to add to it. So some things that increase heat are alcohol, coffee, and spicy foods. So it's best to reduce those, try to eliminate them if you're having those symptoms. And then to include things that are yin nourishing. Those can be, usually they're like dark colored things. So black beans, kidney beans, black sesame seeds, and dark berries. Berries are very good for this. And high protein foods, including fish, poultry, legumes, nuts, and seeds. And then to clear out the heat, then we want to include bitter foods. And those, like, they're not like necessarily really bitter to the taste, but they're just bitter in nature. And so that clears the heat out of your system. Those can be kale, green tea, watercress, turnips, and tangerine peel. And then for types of exercises that are helpful during this time are things that are gentle and are not something that's going to exhaust you. You don't want to deplete yourself during this time. So Tai Chi and Qigong, yoga, we're going to talk about that more in depth pretty soon, and walking and light weight training. And I'm going to teach you a couple of things in Qigong that are helpful. So the first one, you're going to take your hand, you use the palm of your hand, kind of cup it like this, and you're going to pat. So I'll show you that. You just pat along the outside of your arm and along the inside. You do this a few times. You might notice some areas that feel a little tender, so you can focus on those points a little more. You can use your fingertips on those spots. That's where things tend to stagnate, and you want to get the blood moving. And you switch arms, and then eventually you're going to get to your legs. And you should be doing it strong enough that you can feel the circulation moving. And you can get your back and your belly and your head and your chest, just everywhere. Okay, that just gets your circulation going. It helps to get your body functioning better. And then there's one Qigong breathing technique that you start with your hands like this, and you breathe in and you bring your arms up. And you breathe out as you come back around. This one is called lifting the sky. And we'll do one more. Okay. So those are just some things to help really get your body back in balance. And as I mentioned before, it's called a second spring, and that's because it's a time to reconnect with yourself, nurture your body, regenerate. Anytime we look at the different seasons in nature, it's always an opportunity to use that transition time to reboot. So it's time to prepare yourself for a new beginning. Any questions?
Can I get one of those little cups?
Yeah.
Anybody else?
Yes.
About the like goji berries, and I can't remember what the other one's
Mhm.
called. One of them said specifically helps us sleep.
Yeah.
Is it a systemic thing where it doesn't matter if, like, do you want to have that before bedtime, or is it just really incorporating it into your system?
It's more incorporating it into your system
Okay.
because then it's going through it. So
it doesn't matter what time of day.
Yeah.
Okay.
Yeah. And you can just snack on them. Yeah.
The tapping, is there like a period of time that we should do that for, or is it any time we tap?
You can do it anytime, but I would say at least, like for a few minutes every day. It feels really good to do it in the mornings.
Okay.
And then maybe like in the afternoon when you're having that little slump. Yeah. Yeah.
If I'm not gonna give up the coffee, alcohol, and spicy food, can I have like more of the kale? Like, how does that? Because those are gonna be like my 3 favorite things. So I'm not gonna. But it does like more kale balance it or not? So much?
It'll balance it, but just it won't have like as strong of an effect because you're like fighting it, But yeah, you can still do the other things and it'll be helpful. Yeah.
Also a coffee drinker. But does the coffee intake through the day create more night sweats because of the heat you created in your body?
Yeah, it just adds to that heat. So you experience this kind of change in the heat in your body because it's a balance between yin and yang. And so you start out, they're like equal like this. And as the yin starts to decrease, then this heat is felt more. And so if you're having that heat sensation and you're adding more heat to it, then that's going to increase even more and you don't have as much yin to balance that out. Yeah.
How does the Chinese medicine work alongside sort of traditional or like Western medicine? Like, I guess I'm assuming it's complementary.
Yeah, I was just going to say it's complementary. So you can be doing all sorts of things while you're doing the Chinese medicine. Yeah, it's good support for either way. Okay, so now we have Dr. Stacy.
Okay, hi, my name is Dr. Stacy Grote. I'm a physical therapist and I specialize in orthopedics, so shoulder pain, back pain, hip pain, neck pain, and then I also specialize, and this is more my passion, is in pelvic health. So that is treating urinary leakage, pelvic pain, constipation, pain with sex, prolapse, which I'll go over in a little bit, and diastasis rectus abdominis. So I help you get a bit of sunshine where the sun don't shine. So yeah, I want to bring back the vibes to your lady parts. So this is something near and dear to me because every week I hear different stories about patients who are going in through to perimenopause and the conversations that they have with their providers. And so something that stuck out to me recently is I was talking with a patient. She came in to see me for prolapse and rectal pain. And she was telling me that a year ago she went to her provider and she told her that she was having, night sweats. She was having this really stubborn, like she wasn't able to lose weight when she was trying all the things, exercise, eating healthy. She was having these pelvic floor symptoms like overactive bladder and prolapse. And she told her provider this, and the provider said, "This is your new normal." And sadly, I hear these things every day. And so all of the people who have spoken today are going to be your advocate. And so I would highly recommend working with any of these people. So just make sure start like building your team of providers and make sure you're finding someone that's going to advocate for you. Because obviously also we just have to be our own advocate too. So yeah, we'll go to the next slide. So some fun statistics, one I didn't include on there that I forgot to mention in the last session that I wanted to bring up is that men start losing muscle mass at 55. When do you think women start losing muscle mass? 31. Yeah, so this was so sad, like, right? So I'll talk about strength training more later on, but just keep that in mind. It's just not fair. So a lot of these statistics, you're going to see things that might be really common. This does not mean that they're normal. So you don't have to live with these symptoms. So 1 in 3 women are incontinent. That's insane. 33% of us in this room, right, have urinary leakage or maybe fecal leakage too. 1 in 4 women have pelvic floor dysfunction. So that can be prolapse, diastasis rectus abdominis, pelvic pain conditions, urinary incontinence, overactive bladder, versus 1 in 10 for men. Like, come on, that's not fair. If this was men, there would be so much research devoted towards this, right? 20 to 59% of peri and post-menopausal women report pain with sex. I think that number is probably closer to the 50%, at least what I see clinically. And my practice is about between 40 to 50% perimenopause, postmenopause. 50% of women have some degree of prolapse, and I've seen some studies that show that 90% of women who deliver vaginally have a prolapse. So it's super, super common. Prolapse, you can think of it like a hernia in your pelvis. So it's when your pelvic organs descend into the vaginal canal, and people will feel symptoms like heaviness or pressure. They'll feel a bulge. They might feel like something's falling down vaginally. Might feel like you have a tampon inside. And unfortunately, the 2 times that we see these symptoms come about is pretty immediately postpartum. And then as your estrogen levels start to climb again, people start to feel better. And then perimenopause, these symptoms come back. But we have really effective treatments for it, so that's good. 70% of women who are perimenopausal have musculoskeletal pain syndrome of menopause. So meaning joint pain, muscle muscle loss, muscle weakness, osteopenia or osteoporosis. But what was surprising to me is 25% of those 70% will become disabled due to the pain associated with musculoskeletal syndrome of menopause. So that's a huge number, right? And these are things that we can prevent so that, we don't have to have these major life shifts or changes. Something going on disability is we live in California, it's so expensive here, right? So, okay. And then the last one is, I believe it's 84% of women who go through menopause will develop genitourinary syndrome of menopause. And I'm going to go over those symptoms on the next slide. Okay, so these are all of the symptoms of genitourinary syndrome of menopause. So I'm going to kind of go through them and explain all of them. So stress urinary incontinence is urinary leakage with coughing, sneezing, laughing, jumping, running, any movement. Urge urinary incontinence is when you have a really strong urge to get to the bathroom, but you don't get there in time, and you may have a few drops, or you may have like a full-blown accident. Overactive bladder. So if you're someone who has to go to the bathroom at the beginning of this session and you get the urge during this panel, again, you probably have overactive bladder. I'm sorry to tell you that. So that's anyone who goes to the bathroom more frequently than every 2 hours. No matter how much water you're drinking, even if you're like drinking water all day in and day out, you should be voiding every 3 to 4 hours. So if you're going every 30 minutes, you probably have overactive bladder symptoms. Pain with insertion. So during perimenopause, our estrogen levels change so much, and this I probably see a lot postmenopausally because our estrogen is so decreased. As Dr. Phyllis said earlier, all of the cells in our body have estrogen receptors, and our pelvic floor loves estrogen. And so when we have that decrease in estrogen, it causes atrophy of your pelvic floor and thinning of your tissues, which can lead to pain with insertion. So that could be pain with like inserting a finger, pain with gynecologic exams, or pain with intercourse. Pelvic pain conditions, so that could be pudendal neuralgia, which is a feeling of like discomfort in the perineum. Painful and heavy periods, this is what we see a lot during perimenopause because your periods are changing so much. Rectal pain, vaginal pain, urethral pain, pain in your vulva, constipation. So you have a saying in pelvic PT that you're constipated unless proven otherwise. Constipation could be, you could be going every day, but you may not fully be emptying your bowels, and that's considered a form of constipation. If you have pelvic floor tension, that can lead to constipation. fecal incontinence. So that can be anywhere from total loss of stool, or it could be you have staining in your underwear. And then pelvic organ prolapse, which I mentioned earlier. So that's when your tissues so during perimenopause, all of our tissues, like the fascia, the connective tissue, the ligaments, and the pelvic floor, are all impacted by that decrease in estrogen. And so that will cause symptoms like tissue heaviness or pressure. And people will feel that when they're standing for prolonged periods, when they're jumping, when they're picking something up off the ground, carrying a kit, like a bigger kid who's heavier, they might start to feel those symptoms more. Recurrent UTIs. So because of that decrease in estrogen and the atrophy in the pelvic floor, the walls of the urethra actually become thinner, which makes it much more susceptible for bacteria to penetrate, and we can be more susceptible to recurrent UTIs. Lichen sclerosis is an autoimmune condition affecting the vulvar tissues, which will cause like a thinning. Common symptoms with that, because this is a sneaky one, is itching at night. With that, a lot of people will think they have a yeast infection, and they'll persistently go get treatment for it, and it's not getting better. And then, unfortunately, with that, because it is autoimmune and progressive, it will cause the lining of the opening of the vagina to become very thin, that people will actually tear every time they have something inserted. So getting earlier intervention of that is really important. And also, if this is not treated, it can lead to vulvar cancer. So this is one thing I didn't mention in the last one. We should be checking our vulvas monthly, just like you do breast checks monthly. So what you're gonna do, it's not very fun, but it's very important. You're gonna take a mirror. If you're postpartum and you're like, I don't know if I'm not ready for this, don't do it yet, you're fine. You take a mirror, look at your vulva, and then you also wanna touch, and you wanna see if you feel any differences. And it's just like a breast exam. You have to do this monthly in order to know if there's something inconsistent, because you might feel something different, right? And you're like, what's that, right? And then you go and speak with your gynecologist, and they can do a more thorough exam. But monthly vulvar checks are really important in this phase of life. Vaginal dryness, also a result of decreased estrogen, and then itching too can be a result of decreased estrogen. Okay, so next slide, please. Okay, so what is the pelvic floor? So the pelvic floor is a group of muscles that sit at the bottom of the pelvis, and they attach from the pubic bone. I'm just gonna hold this down here. Pubic bone to the tailbone. And these are the muscles in red. So the outer layers support the urethra and the anus, and the deeper layers support the pelvic organs. And they're like a bowl of muscles at the bottom of their pelvis. So they support our pelvic organs. I had a patient who came in with her husband, and he was like, do I have a pelvic floor? And I was like, why, yes, because if you didn't, you would just have skin holding everything up. Isn't that sad? That's how men never have to think about their pelvic floor, right? Until they have their prostate removed. So your pelvic floors provide you stability. They support our organs. When we have failure of that support system, which is the fascia, the muscles, the ligaments, that's when we can get pelvic organ prolapse. If we have pelvic floor tension, we can get conditions like pain with intercourse, overactive bladder, difficulty emptying the bladder, or difficulty emptying the bowel, because the muscles surround the urethral opening and the anus. Okay, this is my vulva that fell off. Yeah, that happens sometimes. If we have pelvic floor weakness, then we can have symptoms like urinary leakage, fecal leakage, difficulty passing our gas, and also difficulty achieving orgasm. So we'll go to the next slide. Oh, actually, so really briefly, I want everyone to do a Kegel right now. So the cues that I like to use for a Kegel is I want you to imagine you're either closing off the muscles around the urethra or the anus, like you're trying to stop yourself from passing gas. Or my favorite cue is I want you to pretend like you're picking up a blueberry with your vagina. Or sipping a smoothie with your vagina. It works. Okay. So what you should feel is your muscles lift away, okay? If you really want to get in there, you can actually feel like around your sit bones with your hands, but maybe for another day, I don't know. You're welcome to do that though. Nothing's ever TMI with me, I've heard it all. And so you should feel a lift and a bulge, okay, when you do that. And it is easier to do this if you can feel with your hands. So if you feel the lift, but you don't feel the muscles bulge, and you have prolapse, urinary incontinence, overactive bladder, then it could be a sign that you have pelvic floor tension and you would benefit from a physical therapy evaluation. If you feel nothing, then it's a sign that you might have pelvic floor weakness and you would also benefit from a physical therapy evaluation. So some effective treatment strategies for genitourinary syndrome of menopause. I had a patient who came to see me for urinary leakage, overactive bladder, and pain with sex. And so I worked with her provider to give her some local vaginal estrogen while we worked on her pelvic floor tension. And within 12 sessions, she had complete alleviation of the pain. She was having really pleasurable sex. She wasn't having any overactive bladder symptoms, like her UTIs had gone away. So very, very impactful. Physical activity and exercise is just great for your pelvic floor health. So pelvic floor therapy is not just Kegels. I had a patient in yesterday who has urinary leakage with jumping. We didn't do a single Kegel in the session, and she left feeling like she got a workout in. So full body exercise is actually really, really good for your hormone health too. Strength training goes along with that. Okay, so this is kind of a fun study. So vibrators, they've done a couple cool studies over the past years, and I'm just very curious as to who signs up to be a participant for these. I'm like, sign me up. No, I'm just kidding. So there was a study that came out a few years ago that's 20 minutes of using a vibrator actually helps to increase your pelvic floor strength weekly. Just 20 minutes a week, that's it. In a survey done in 2024 of postmenopausal women who regularly used a vibrator, I'm not sure what the frequency of that one is, reported decreased depression and anxiety, decreased overactive bladder symptoms, decreased prolapse symptoms, and decreased urinary leakage. So break out that vibrator from your bedside table. And yeah, like I said earlier, pelvic floor therapy and topical estrogen or hormone replacement therapy works really well together. So we always like to collaborate with other providers too, to make sure a patient gets symptom relief. So now talking a little bit about the musculoskeletal syndrome of menopause. So that refers to any joint pain, muscle pain, sarcopenia, which is loss of muscle, osteopenia, and osteoporosis, and that's when our bone density decreases because of that decreasing estrogen. So this can present like neck pain. It can, because of the decreased estrogen, inflammation goes up, right? So that can lead to all of the itises like Achilles tendonitis, plantar fasciitis, frozen shoulder. So frozen shoulder, the really, really good evidence to support physical therapy plus cortisone injections for improving mobility with frozen shoulder. Hip pain, low back pain, knee pain, shoulder pain, foot pain. So all of these our joints can be impacted by the decreasing estrogen levels. And then the other thing too you want to think about is because people aren't sleeping as well during this phase of life, and I have a 9-month-old baby, so I feel like my pain is elevated when I don't get as much sleep. But when our sleep levels, or we're not sleeping as well, pain goes up. That's just been proven study after study. So hormone replacement therapy can help with sleep, right? So that can also in turn help pain. Then that stubborn fat that's difficult to lose, unfortunately it puts more pressure on our joints, and that can lead to more inflammation and irritation. Can we go to the next slide? So as I mentioned earlier, 70% of women will develop some pain associated with menopause. So this is why strength training is a total non-negotiable. So I was saying earlier, like in the earlier session, if you're in your 30s, start strength training. If you're in your 40s, 50s, 60s, your 20s, start strength training. Tell your daughters to start strength training. All it takes is 2 days a week, trying to train the full body. And then you want to make sure you're not just doing like machines at the gym. You want to be like in contact with the floor, squatting, push-ups, doing deadlifts. The stronger our muscles are, the more our joints are supported, and that's going to help with decreased pain. Yesterday, I had a patient who has, and like now thinking that she may be starting to be in perimenopause, she's in her late 30s. She came in to see me for back pain and sciatic nerve pain, and she's had this pain for 10 years. And she's gotten injections, she's like never gone the surgical route, thank goodness. But she's just in this constant cycle of having to get cortisone injections every 6 months. So she's finally out of the pain, and yesterday we started doing some strength training. We just did some squats with some dumbbells, and she was like in tears. She was so happy. She felt like she could never do this, like she felt so empowered and she was like, who am I? So I feel like I got teary with that too. But we want to make sure we're not in pain when we're doing strength training too. So physical therapy or chiropractic with Dr. Pearl can help with pain management so that we can lift heavier. The number one thing I always tell, the easiest thing to do is go out and buy a weighted vest. You can buy them on Amazon. I think they're like, you can buy a $20 one on Amazon and then just start walking with a weighted vest because that helps with increasing bone density. Another statistic is that the top 2 reasons that people go into nursing homes, number 1 is falls, number 2 is incontinence. So yeah. So these are all things that we can treat, right? Any of the, like all of us providers up here can help you prevent that. So yeah, I'll just finish with a patient story. So I had a patient, changed her name for HIPAA reasons, but her name is, let's say her name is Jen. She came to see me from a workshop that I did at her yoga studio. And she had urinary incontinence with jumping and with like jumping jacks and jump rope. And she really liked to go to this like yoga sculpt class where they do a lot of jumping. She also had overactive bladder, so she felt like when she would go out to run errands, she would have to like find a bathroom somewhere. But that's another thing. If you're a person who's like, I gotta go to the bathroom just in case, sorry, you have overactive bladder. So she had overactive bladder, and she also had this chronic low back pain with sitting, which now thinking about it, she probably has musculoskeletal pain syndrome of menopause. And so after we did an evaluation, we actually found that she had a lot of weakness in her pelvic floor, and by strengthening her core and her glutes, strengthening her pelvic floor, she's now to a point where she can go to her sculpt class and jump as much as she wants. She doesn't have back pain anymore with sitting or with lifting. And she feels like she can go out for like 3 hours and run all of her errands without having to worry about her bladder anymore. So she told me at the end of our sessions is that she doesn't have to think about her pelvic floor and her bladder anymore, and that was really empowering for her. So I just want you all here to know today that you don't have to live with any of these symptoms, and I would love to help you. So I'm doing a workshop with Dr. Pearl next month here. That's going to be more interactive, so we'll be exercising and more solutions oriented as well. And then also the questionnaire that I put out, if you have any of those symptoms, it's just like a nice checklist to see if you'd be a good candidate for pelvic floor PT. So yeah, you don't have to suffer. Thank you. Oh, any other questions?
When it comes to UTIs, it's interesting to me that over the years, it's changed how often we're recommended to go see the gynecologist, and now they're pushing it like 5 years. They say if we're not active sexually.
Yeah.
How often do you think we should see the gyne?
Yearly? Annually?
Yeah. Thank you for that.
Yeah. I think that's, so I know after 70, you don't even have to go at all anymore, right? That's what I've heard. And then I've not heard 5 years before. I thought 3 years for a tap.
It's changed.
Yeah, they keep pushing it.
I swear like Kaiser recently told me 5, and I was shocked because I swear when I was younger it used to be maybe 6 months or a year.
Yeah.
And then it's 3, and then it's 5, and I've noticed a lot of people don't realize when they have the UTI.
Yeah.
They don't always have symptoms, and then they discover it in the ER when something else happens.
Yeah. So the local vaginal estrogen can really help with preventing UTIs during menopause and after menopause, and that can be taken throughout the life, and it's really not absorbed systemically, which is kind of nice. So if you have any like reservations about taking HRT, then local estrogen is great. There's an amazing physician. She's a urologist specializing in female sexual medicine called Dr. Rachel. Her name's Dr. Rachel Rubin. She's such an amazing advocate for women's health. I would recommend following her page because she's just so knowledgeable. But yeah, good question. I would say like if you have any symptoms, then go to your doctor, right? And if they just say, like one of my patients also said that her doctor said, "Welcome to the club," and I was like, okay, I don't want to be in this club. Like, any other questions?
I have a question.
Yeah.
But I'm currently a patient, and if you have any hesitation, 110% recommend an assessment.
Thank you, Megan.
Hello. Is everybody getting tired? Lots of good information though, right? My name is Sarah Kirk. I'm a licensed marriage and family therapist. I've been licensed for a long time, like 25 years. And I have a private practice. My specialty, after I had children, really moved into postpartum maternal mental health and grief and loss in couples. But it's really been my passion to work with the maternal mental health population. And my road to working with perimenopause, menopausal women my journey was pretty rough. I really wish that I had had the information you're getting today much earlier, but that's okay because all is well now because I've taken and reclaimed and made decisions and choices with the information I got. So, but what happened was I had a lot of my postpartum women who had symptoms of postpartum, which happens because that is another time of life when estrogen greatly drops and there is high stressors in life, contributing factors. So we worked through that, and some of them stayed with me to work on other life-changing events and such, or they kind of came back, and with these resurgence of symptoms. I'm on telehealth, and I have their chart here, and I'm like opening it and doing the math in my head of how old they are, and I'm like, this is really interesting. And this light bulb went off that I wondered, women who struggle with postpartum, do they also are they more likely to struggle with symptoms in perimenopause and menopause? And I just kind of chewed on it. And then I did a training and started doing my own research and educating myself. And lo and behold, it is one of the kind of like risk factors or contributing factors. And I work, I did used to have an office down at Hoag, and I work with a psychiatrist that works with a lot of women's health. And I had told her, hey, I just wanted to let you know I'm kind of moving into this world. And she said, guess what? So am I. Because she is seeing so many women in her practice as a psychiatrist that she is getting trained to prescribe hormones. And I thought that was fascinating. I'm like, a psychiatrist that's going to be prescribing hormones. How awesome is that? So anyway, so that was my road to this specialty as well. So I'm, I am focusing a lot on the more mental health side, but I can't neglect some of the physical symptoms. But these are the more common psychological symptoms. So, brain fog, forgetfulness, memory issues, poor focus and concentration, low energy, exhaustion, low motivation, decreased self-esteem, depression, mood swings, tearfulness, anger, irritability, anxiety, panic or even panic attacks, sleep disruption, insomnia, feeling disconnected, a loss of enjoyment of things that you used to find enjoying, and a loss of libido. So there are contributing factors. So what are those contributing factors that are leading to these symptoms that can happen for some women and many women on that list? And it's those hormone fluctuations. There it is again. The fluctuations in estrogen levels impacts the regulation of serotonin, which is in the brain, which can lead to symptoms of anxiety and depression in some women. And it can affect a feeling of emotional well-being. And that, again, there's that drop in estrogen that's a contributing factor. Sleep disturbance. So this is a big one. It's a big one in mental health. When my postpartum moms come to me, first thing, how are you sleeping? What's your sleep patterns? When there is a lack of sleep, there is going to be an increase in symptoms, difficulty coping, and difficult that you have a harder time utilizing the strategies that normally you can access. It's like it just kind of goes out the window. So the estrogen influences the metabolism of serotonin and other neurotransmitters that help regulate the sleep-wake cycle. And low estrogen disrupts the hypothalamus's ability to regulate body temperature, leading to night sweats. These changes can lead to insomnia, fragmented sleep, early morning waking. Who wakes up at 4 a.m. and can't go back to sleep? And then your husband comes out or your partner or your kids, and they're like, at 8, I'm so tired. And you're just like, don't even talk to me, right? And also it can lead to daytime fatigue. And when your body is not feeling well, your brain follows. It's like that mind-body connection. When sleep is impacted, I mean, if you lose one night of sleep, you're feeling like crap the next day. If you lose a week of sleep, 2 weeks of sleep, 2 years of sleep, over time, much more prone to symptoms. And that irritability, depression, anxiety, and again, that difficulty coping. Another contributing factor is the changes in the physical body. So, you know, if we were here just telling you everything that like could happen to you, you'd leave here, how would you feel? Like, I'm super stoked and my life is looking really up, right? You know, so you're not feeling well, your brain and your thoughts follow. So there's that mind-body connection. And again, if your mind is not feeling well, you have more pain in your body. So really it's that the negative thought patterns can get pretty gripping and can spiral. And so if you have a lot going on physically and you start thinking, my life's over and, you know, I just may as well give up and I can't drink alcohol or drink caffeine and, well, yay. So, you know, it's really being aware of that mind-body connection, but a contributing factor is definitely the changes in the physical body. But there also are a lot of life stressors. This is a season, and it's a long season, but it's a season. So in the beginning of the season, you could have young children, and that's, you know, stressful. You know, as this season goes on, you're at the pinnacle of your career, or you have kids going off to college, or you have aging parents, you have loved ones that are passing. So there's a lot of life stressors that kind of contribute to some psychological symptoms. So another factor is your family history. So if you have a family history of any mental health disorders, just keep being mindful of how that might impact you, and also your own personal history. If you did have postpartum, if you had depression as a younger person, and I've had clients that are like, well, I had depression or I had a little bit of anxiety when I was in college or high school, and I was fine, and then all of a sudden now it's happening, I'm having these symptoms again. It could be really related to some hormone changes. So, and also that postpartum. So if you had postpartum, it's not for sure, but just to be mindful, you know, like hormones, and also in premenstrual. I know I wanted to kind of address what you were asking about. There is a premenstrual mood disorder. And if you have premenstrual mood disorder, I recommend to my clients that you have a game plan, right? You have a game plan. So when the brain is off, when the brain is already off and running, you actually are in a different part of your brain. You're in that fight or flight center. And it's really hard to think, what do I need to do? Maybe I need to breathe, and maybe I need to go on a walk. It's out the door. But if you have it written down, or if you have a reminder and you don't have to think about it, that's very helpful. What happens during that chaotic phase is you're not sure when it's going to happen. But if you still have some tricks written down, if it's the time to actually have a plan of self-care. If you do have, like during postpartum, my clients, it's like, what do you enlist right now? What are you doing right now? If you have premenstrual mood disorder, or if you know that a certain time of the month, there's a mood tracker in there. I have a symptom tracker and mood tracker in my handout there. If you notice there's a certain time of the month, you have a plan. And you also take care of yourself more. But if you don't know and it hits you because you're in that chaotic, fluctuating time, you have it written down. And one time going on a walk might help with a friend. The next time you might need a nap. You might need a bath. You might need to stomp on the ground. You might need to let people around you know, hey, I need a minute. And, or something really bad is going to happen. And I have my list here that I made when I was calm and not in this state, and I'm going to go through the list. The tapping, actually, tapping gets your central. It kind of like shakes your central nervous system. So when we were doing the tapping, like something so simple like that, if you do and a bilateral tapping even, but it's the same type of tapping. So you just have some things written down. So I wanted to address what you were saying, like, what do I do if I'm like, in this, and I can't predict it? You need to have a plan, and it always helps to kind of have some ideas in your back pocket. So I wanted to take a second to address that. So what can help? Okay, keep a symptom and mood log, which I have in the packet, and that also does address physical symptoms, because again, that mind-body connection. And then you could take the log to your doctor, who you're going to find a new doctor who's going to listen to you. And if you take that and say, I'm having these symptoms, and they say, oh, but you're having your period. So, or no, you're not a year of, you're not in menopause yet. And you're going to find another doctor that's going to listen to your symptoms. You're going to come see Dr. Phyllis. So the best thing you could do is what you're doing right now, is you're empowering yourself through education. So I have, it's the best thing you can do, because you're not leaving here thinking, oh great, my life's over. It's okay, if I have these symptoms, now what? And you're developing a team of people around you, and you are talking to your friends and your girlfriends and your family members, and everyone is on board. And so it's just empowering. That really can help your mental health, really, really help your mental health. Know your options. I'm not going to talk about those because you've heard about all those, but knowing your options. Do you want to go the hormone route? Do you want to do, you might want to do all of it. I did all of it, by the way. I did all of it. I lived here for 2 years. It's really the truth. Find a perimenopause, menopause-informed doctor. If your doctor minimizes your symptoms, find another doctor. There is a site on the resources, the Menopause Society. They have an accreditation. People can go in there and actually recommend doctors, but they have an accreditation of doctors that take an extra set of coursework, and then they have to pass a test, and then they get listed on that site. So that's a cool site if you don't live in the area, if you've traveled with a friend here and don't live around here. Okay, prioritizing sleep and self-care. Super important. Meditation helps. Meditation apps help. If you're waking up at 4 a.m, Calm and Headspace, put it on your phone. There are various apps that can help you get back to sleep. Part of modifying expectations, I'm jumping to the next one, we get a little stuck. And we think, I am not taking a nap. I've never had to take a nap, and damn it, I'm not taking a nap. I'm not a nap taker. You might need to think about taking a nap and then see how you feel. Like, if it didn't help you, great. And like that whole thing of like reduce alcohol or reduce caffeine. And I was so mad when I was being told I had to stop everything. And then I was like, you're not taking everything away from me, because my life already feels like it's over. And so I was like, well, but I can have a glass of wine. I just can't have 10 margaritas anymore, So I can still have my coffee, but maybe not after 12. If I have coffee after 12, I will not sleep. I'm like, it impacts me that much. But I was mad, and I was having coffee at 3, because you're not taking my 3 o'clock coffee away from me. So you're really modifying your expectations, but if you make the choice, that is where you get empowered. If someone else tells you, that's when you get pissed off. So that's what it's about. And if you try these things and you feel better, then you're making the choice. And so I invite you to have people around you that talk to you about it in a different way, and it will feel different. But doing things for sleep, like a cool room, limit caffeine later in the afternoon, and see how you feel. Some people might not make a difference. Know your options for sleep. So there are various things you can do. Talking to the right people, again, supplements or some medications. I don't mean sleeping pills. I mean, just there's other things. Hormones can help. Exercising can help sleep, and then limit screen time before bed. Sorry. Again, that would be a choice. You don't have to, it's a choice. But modifying expectations for self and others, I just think that's a huge part of this new spring. It's like, what are my expectations? Pause before you say yes to others. Let people around you know what you're willing to do and what you're not, but you're making the choice. And modifying expectations for your body, and not being mad at your body, but making the choice to take the modifications on your own. It's very empowering, and again, there's that brain, the thoughts can shift. And then seek therapy. If symptoms persist, having a therapist as a part of your team can be very helpful. Cognitive behavioral therapy is very helpful. Just having someone that understands. A team approach. And then so you're just adding someone else to your team. And it could be very temporary. Someone who understands and can help you gain strategies. forgot to mention that I might talk fast because I'm super excited about this. So I apologize if I'm talking fast. But just some takeaways. We've heard this before. You're not alone. And I also do want to say this. I mentioned this in the last session, but I felt really frustrated because some of my peers were like skipping through this. Like, I don't know what your problem is. Like, I'm so cool, and I can, and I just felt like, what in the hell? But really, it's impacts different people in different ways. Like other phases of life. And you will find a community, and you are not alone. And if you start talking about it, you will have more and more people that are like, oh yeah, that's right, that's happening to me. That's happening to me. And then support and treatment options are available, and understanding your body and mind to help you regain control. And empowerment starts with education and care. So that's my little spiel. Does anybody have any questions? Nope. Okay.
Hi everybody, I'm Marcella. I'm the yoga teacher, yoga therapist here at Bixby Knowles. And I'm just gonna get my notes out. They're on my phone. And it's a good thing I put on my SPF before I did this. Because I know. Okay, so just to give you a little bit of background about myself, I've been practicing yoga for about 30 years. And I've been teaching yoga for about 15 years. I didn't mention this the first time around, but the second time I'm going to say this. I started going through the change when I was probably about 35, and of course nobody believed me. And then finally found a doctor that was, yes, you are. And I'm just so glad that I had yoga in my practice, because I will say that when I finally was like, oh my gosh, I'm going through the change, everything changed. My body changed. I couldn't do 108 sun salutations anymore. So my yoga practice changed. And I couldn't drink coffee anymore. I had to drink green tea. It was just so weird, all the things, the small little things that I took for granted changed in my life. So again, just grateful that I had yoga to kind of help guide me through those changes. So yoga can be a very powerful tool for helping us manage menopause symptoms by promoting physical relief and emotional balance. So yoga is a science for the mind. It is very old and ancient, thousands of years old. It's biblical time. So it has a lot of knowledge in there for us. And how it helps us is regulates our hormones. So there are certain poses like forward folds and inversions that help stimulate the endocrine system, which can help with hormonal balance. So with a yoga practice, I know you've all seen the amazing yoga poses, standing on your head, doing all these great, amazing things. That might not be the yoga practice for you. As Dr. Long touched on in her presentation to us, is that if we already have heat in our body, we don't want to add more heat. So a lot of yoga classes, group classes, heated classes, that's all it's going to do is bring more heat to already hot body and just make those hot flashes and those night sweats even worse. So that was how my yoga practice changed. Like I said, I stopped doing the 101 sun salutations, because if you think about it, sun salutation, you're worshiping the sun. You're inviting the sun into your body. That's heat. So we don't want to do that anymore. So my practice changed to a lot more gentler, more mindful practice, with still forward folds and inversions to kind of help regulate my body and help me with the hormonal changes that I was going through. Oops, I lost my notes. Oh, here we go. So reduces hot flashes. Yeah, there are a lot of cooling poses that we can do to help calm the nervous system and reduce the intensity of the hot flashes. improve sleep. We heard so much about sleep today, right? How we need that sleep. So a gentle yoga sequence and breathing techniques, we call these pranayamas, can help with insomnia and promote better sleep quality. Again, I'm very, very fortunate, and I think I owe it to my yoga practice. I'm 55 years old. I am post-menopause. I sleep like a baby every night. I really do. Like I'm hearing like people's stories, and I'm like, gosh, I am so grateful. Well, okay. I sleep. Actually, no. I sleep better than my husband. He's the one that gets up at 4 o'clock and a.m. and he says you're snoring away. So yeah, I guess so. Okay, so where was I? So a regular yoga practice can help ease joint pain. Menopause can, as we know, menopause can lead to stiff jointness, to joint stiffness. But yoga keeps the body flexible and it lubricates the joints through mindful movements. Boosts mood, reduces anxiety and depression. I can so relate to Dr. Lisa showing that little box of that crazy, crazy time. And again, just thankful that I had my yoga practice to kind of help get me through it. Because that's what it does. Yoga encourages relaxation and helping us to helping us to alleviate mood swings, anxiety, depression, and stress. So, and our yoga practice also supports bone health. Weight bearing and balancing poses help maintain bone density, which is crucial during menopause. So I just kind of want to touch back on pranayamas. So I'm sure you guys have all heard about pranayamas or breathing techniques, and I would like to share one with you. This one is called Shitali Pranayama. Shitali is a Sanskrit word, and it translates into cooling breath. So what we're going to do is, you're going to stick your tongue out, and you're going to create a U shape with your tongue. Now, not everybody can do that. It is genetics or practice that helps you to do that U shape. And if you can't do the U shape, then you can just go like this instead. Okay? And then what you're going to do is you're going to breathe through that tongue. You're going to take an inhale like you are using a straw and breathing in cool air. And then you'll close your mouth and then you'll exhale out of your nose. So when you did that, did you feel that cool, like I hit a cool air coming in? Awesome. Okay, so we're going to do that about 5 times. Yeah, you can close your eyes if you want to. So first of all, you're just going to sit up nice and tall. Good. And then you're going to stick your tongue out or just push your lips together like that, and then take a gentle inhale in, like you're sucking through a straw. And then you'll close the mouth, and then you'll exhale out of the nostrils. Good. And then when you're ready again, you're going to take that inhale, so you're going to stick that tongue out. And then you'll exhale. And then you'll inhale. And exhale. And then inhale. And exhale. Good. And then I lost count, so we'll just do it one more time, just in case, just to make sure we get it in there. And exhale, nice. So it's recommended that you would do that before you go to bed at night, or you could do it first thing in the morning. You can do it for 5 times, 10 times. You can do it up for 5 minutes. And the benefits of that practice is it's going to regulate your body temperature to help with those hot flashes. It's going to calm the nervous system to ease stress and anxiety, promote better sleep, especially if you do it before you go to bed. I've even tried it when I've woken up one time with I was having a night sweat, and I thought I'm going to try this, and it did help to kind of cool me down and get back to sleep. If you wear a mouth guard, you might want to take your mouth guard out because you'll get a better cool breath in, and it also helps to enhance relaxation. So it just helps to relax you basically. So I hope you enjoyed that, and so that is how yoga can help with menopause and perimenopausal. So just to touch on what I do here, I do teach yoga here every Saturday. It is a gentle yoga practice with meditation. Oh yeah, meditation. So we've heard about stress, how stress can be a big factor in our menopausal symptoms. So meditation can definitely help. It's not easy to meditate. I can attest to that. And some days are good and some days are bad. But the more you practice meditation, the better you'll get at it, and the more you're going to see the benefits in helping with your stress. So if you want to come along every Saturday at 9 o'clock, we'll be here practicing some gentle yoga with meditation to help with all that, to help you get a regular practice. And then at the end of this month as well, Dr. Pearl, I'm going to be, it's in your...
It's on the back of the program.
It's on the back of the program. I'll be doing a workshop for yoga, and this is where we will be practicing a restorative yoga practice. It's not very common, a restorative practice. This is where we will use blankets, props, all kinds of things to kind of hold you in a yoga pose. It is very gentle, very relaxing. People fall asleep. So talk about you not getting enough sleep. This practice is very nourishing. And like I said, it's common for people to fall asleep. And when that happens, I let them sleep because they obviously need it. So if you want to know more, speak to me afterwards and I'd be happy to answer any of your questions. In fact, I'm happy to answer any of your questions now. So any questions? Okay, great.
All right, I'm going to be brief. I know we've kind of gone over the time we said we would be here with you, but was worth it, right? We got a lot of great information. So again, I'm Dr. Anna Pearl. I'm a chiropractor, and let's get down to business. So menopause, in essence, is an inflammatory event. Estrogen is a protective hormone, and as estrogen decreases, so does our protection. This is why we see the onslaught of all of the symptoms that are associated with perimenopause that all of the other providers have gone over. But, especially in my world, like osteoporosis, loss of bone density, increased incidence of coronary artery disease, insulin resistance, type 2 diabetes, visceral fat gain. We've all talked about women gaining weight, not being able to lose it, decreased muscle mass, muscle density, and neuroinflammation, right? Brain fog, inability to concentrate, actually decreased multitasking. That's been an interesting study. Our estrogen is what helps us be able to multitask really effectively, especially compared to men. So these are my big 5. And these are the 5 things that, if we're going to just talk about thriving through perimenopause and menopause, these are the 5 things I would suggest my patients focus on. And this is the 5 things that we all kind of need to focus on with any sort of injury: sleep, nutrition, hormones, resistance training, and nervous system regulation. So Dr. Phil everybody's talked about sleep. That is because our hormones balance during sleep. This is when our body takes an assessment of how much we have, how much do we need to resorb, what's bad, what do we need to make more of. That happens when we're asleep. And sleep supports our hypothalamus, pituitary gland. These are the areas of the brain that help regulate hormone production. Sleep deprivation increases the production of cortisol, which is the stress hormone, which is inflammatory. Inflammation makes us
sick, gain weight, hurts our immune system. And it also increases the production of a hormone called ghrelin. That's our hunger hormone. And they've done studies, even like an hour. Like, let's say you're a 9-hour person and you're getting 8, you will have more ghrelin. You will be hungrier. So I don't say, like, don't give into it. You're already tired, but have like a high protein, like low, or like, and not sugary, not something that's going to spike your blood sugar. So that way you can get through that hump. Vicious cycle, our melatonin production decreases during perimenopause. That's part of why we have a harder time going to sleep and staying asleep. Melatonin supplementation is great, but also sleep hygiene, things like Sarah mentioned about being in a cool room, reducing screen time before bed, and then a lack of sleep would impair insulin sensitivity and thyroid function. Again, very important for preventing diabetes and keeping yourself at a healthy weight. This might be the slide if you want to take a photo. These are just some really basic things. We're actually going to have a workshop with Megan, who's in the back. Say hi, Megan. And in July, she's going to be hosting a talk here specifically on nutrition for perimenopause. So she'll go more in depth, but this is like nuts and bolts. I like to be pretty simple. Sufficient protein and strategic supplementation, because I know people that are taking like 25 supplements a day, every day. It's exhausting, right? So in relation to perimenopause, these are some basic recommendations. So protein, 1.2 to 1.6 grams of protein per kilogram of weight per day. So this is important for maintaining muscle mass. Omega-3 fatty acids, that's going to help it's a natural anti-inflammatory. It'll help improve your mood, reduce hot flashes, and support brain health, 2,000 milligrams a day. Vitamin D and K, D, 1,000 to 2,000 IUs a day, aids in calcium absorption, and K2 is actually what shuttles that calcium into bones. So you've got to take them together. Magnesium and calcium, magnesium 350 to 400 milligrams a day, calcium 1,200 milligrams a day. This is going to improve bone mineral density and vitamin D activation. And then reducing inflammation. So we want to limit, not eradicate, but like alcohol, sugar, saturated fat, sodium. And then hormones, do not ignore them. Get them checked out. Get them checked out by a provider. So one thing, do not throw away. I don't want to see any of these programs in my trash cans. There are so many resources in there. Sarah Kirk painstakingly put together, really, really lovingly, a ton of resources for you guys. So there's some websites on where to find providers that are really in touch with this stuff, as well as a symptom checklist. Dr. Stacy gave you a symptom checklist. So definitely make sure you're looking in there. So we want to check out our hormones. And the earlier the intervention for oral and for like patch, the more effective. So Dr. Stacy mentioned earlier to me as I brought this up that vaginal estrogen is still really effective in older women. So like for our mamas and stuff. And really exciting, a study came out this year from the American Urological Association, women that were taking vaginal estrogen to help with the prevention of UTIs, which it did. It also reduced their risk of sepsis, which is infection in the blood. It also reduced mortality, meaning death. So like this is really, really important and so empowering that we do have this tool again. It's not going to give you cancer. And if you're somebody that's open to it, it's a great tool in your toolbox. Resistance training, for all of these reasons. I don't have to go through everything, but I will say, like, I see a lot of women in their 50s and they stop doing everything except for walking and swimming. That's not going to cut it. You're a fall risk. I've seen it happen. Break your hip and it's just downhill from there. So and whether that's a weighted vest, whether that's yoga, whether, and I like Dr. Stacy saying you need to make contact with the ground, right? And we have tons of stuff options here, but you can do it on your own too. And then I'm a chiropractor, so I have to talk about your nervous system and how chiropractic care can help during this transitional period. So chiropractic adjustments actually help put your body into a sympathetic a nervous system state. I'm sorry, parasympathetic. Parasympathetic is like our rest digest, and sympathetic is fight or flight. And a lot of us, we're in fight or flight all the time. We are having really big cortisol spikes because of text messages, not because a lion is chasing us and we have to run to be alive, which is really what that system was designed. And it goes to every organ in our body, basically. And so that's a really powerful tool, and it feels great. Really does help improve sleep quality. Anybody who's brought their babies here to me, or Dr. Whitney or Dr. Alex, can attest. The children and the babies sleep a ton better after being adjusted, and I hear it all the time from my patients as well. So decreasing stress and tension, because you get some nice endorphins and serotonins when you're adjusted, and it enhances your mind-body connection, right? This is something Sarah talked about a lot. So being more in touch with how you're feeling, that happens sort of like big picture-wise, but also on a very little specific scientific level. Inside of our joints, we have nerve endings called proprioceptors. They tell our brain where we are in time and space. If we are out of whack and our joints have restrictions, those proprioceptors stop giving good info to the brain. Like, we literally do not have as good of an idea of like where my arm is in time and space. You get adjusted, it acts like a restart mechanism. That's why you're like, oh, I feel straighter. Maybe you weren't like this when you came in. Sometimes you are, but you feel straighter because your brain is now getting good data. So that's that. Those are my big 5. And this is our upcoming events. We touched upon the yoga for menopause is going to be June 28th. That's a Saturday at 11:30 a.m. with Marcella. Dr. Stacy's going to come back on the 12th of July and do a pelvic floor workshop. That's going to be more active. Moving the body is much smaller because we need to be able to move around. So definitely want to RSVP to that soon. The nutrition for perimenopause workshop, that's coming up on the 19th. Is that right, Megan? Okay, at 1:30. And then we're doing a really fun class. It's a collaboration between Dylan and Marcella to do face revival yoga. So a little bit of gua sha, that kind of technique, lymph drainage massage and your face for yourself, and then facial yoga poses. I don't know if you want to take a picture, that's where you RSVP, but that's also on our website. If you go to bigspinalswellness.com/events, you can see everything we have coming up. So let's have one more round of applause for all of our panelists. And we're going to hang out for a little bit if you have questions. Thank you so much for coming. We really, really appreciate you.